Hello, everyone, and welcome back to another episode of Horty Springer's Health Law Expressions podcast. I'm Mary Paterni, and with me today is the lean, mean health law machine, Hala Mazaffer.
I appreciate the nickname, Mary, but that's just how they know me in the streets.
Hala, we pulled this podcast together because CMS recently published a memorandum on April 1st that had both of us kind of sitting in our chairs like, what is going on? So they published this memorandum updating or notifying hospitals that they've updated the interpretive guidelines as it pertains to informed consent. And when I saw this, I was like, why are we updating these guidelines? Mm-hmm. Informed consent, right? But it goes back to this idea or this traditional practice when it comes to sensitive examinations. And these are examinations that are being performed on patients who are under anesthesia. And this traditional practice is being done by residents, APPs, other practitioners in training mostly. So we're seeing this most common in teaching hospitals, right? And they're performing these examinations while the patient is under anesthesia. I'm talking pelvic examinations. Those are the most common. Breast examinations, prostate examinations, colorectal examinations. And at first you're like, okay, but the problem here is that the patient has no idea in most cases that these examinations are actually happening. So they are going in for a particular procedure. It might not even be related to the examination they end up receiving. They receive that examination, and then they wake up after the procedure, none the wiser. I don't know how you felt about that.
Yeah, I mean, so reading the memo at first, I was, to give you a little slang term, I got the big ick about it.
Is that what the kids are saying?
That's what the kids say. So I got the big ick about it. I guess it was just really uncomfortable for me because my impression of how they do this kind of training is that they either bring people in specifically to give these types of learning exams, or they get patients' consent. So to find out that it happens without any consent, or it could have happened to you or me without us actually knowing.
Right.
Very uneasy about that.
As a patient.
Yeah.
I would be very concerned or very, very uncomfortable with that idea that I might be going in for one procedure and then receive a completely unrelated examination. So sometimes, I was reading through some of the medical literature on this. These are examinations that are not for diagnostic purposes, not all the time for diagnostic purposes or therapeutic purposes, are not related or not medically indicated or medically necessary for the procedure that is being performed. One example that was provided is that a female patient received a pelvic examination while she was undergoing a procedure that was non-gynecologic. So, I'm going in for one procedure and then I'm coming out having an examination on a totally different part of my body. And I had no idea that it happened. And so, this is, again, a little bit of an ick, in my opinion, or as the kids say. So, because here we're performing, or these students are performing these procedures or these examinations, and the hospital or the providers are not getting that patient's informed consent beforehand. And I think that's a little concerning because on the one hand, they may take the position that there is some benefit that is afforded to the teaching process itself. It allows these medical students, it allows these residents to practice those examinations on a patient without causing that patient any discomfort because they're under anesthesia.
Yeah, don't know about it, yeah.
But I ask at what cost? Because here we're stripping that individual of the autonomy here, that individual choice to have that examination performed on them. So I don't know about you, but I found this a little bit surprising and shocking.
Yeah, and I don't think we're the only ones. So in the past, probably since around 2004, I think it is, 14 states have actually created informed consent laws that specifically address these sensitive exams. But the only problem with the laws are, as with most state laws, they're just wildly inconsistent depending on the state.
So they vary.
Yeah, so it varies. So not one thing is addressed in all of them. So some of them say you just have to say the type of provider that's doing this exam. Some say you have to specifically say that a student might be doing an exam like this for educational purposes. Some say you have to say exactly what type of exam. And only one of them, one of the states, has a penalty if you break this rule.
Only one?
Only one. So it's uneasy. But I mean, they have made this little bit of effort and acknowledged that, hey, this is going on. We don't like it either. But again, it's only 14 out of 50 states. So not everybody has addressed it, and they certainly haven't addressed it to, I think, what you and I would think is the extent that you need to address it.
Right.
To get rid of the ick.
Right. Title of this podcast, Getting Rid of the Ick. No, I agree with you. And I think this has probably gone unnoticed for, I don't know how long that this has been happening.
Mm-hmm. Yeah.
We don't know. It's been talked about for a while. And it mostly started, mainstream media has this has caught the attention of mainstream media, of course. But it had to be brought to our attention by the physicians or the surgeons or the medical students themselves, mm-hmm. who have come out of the woodwork and published literature on this topic saying we had to perform these examinations at one point, mm-hmm. and it didn't feel right. We didn't feel like we were doing the right thing at that point because we knew that individual who was under anesthesia wasn't even aware that this was going on. So it's honorable on their part for bringing this to the forefront and bringing this to the table so that we can discuss it and have a plan. This is not acceptable moving forward.
Yeah.
And so I'm glad that the states have caught on to this too, because we're lawyers, right?
Yeah.
So we think like lawyers. We have, on a good day.
Exactly.
We're still practicing. But we have to think like lawyers. We have to think the way other lawyers are going to think. And so when it comes to these examinations that are not medically indicated and they're not, or informed consent is not obtained from the patient, it really begs the question of whether or not we're opening ourselves up to, or the hospital, for instance, or the provider is opening themselves up to some sort of liability. Because there's a lot of states out there who recognize the lack of informed consent as a cognizable claim. And so you have these examinations that are being performed without first getting the patient's consent. Well, does that amount to an unauthorized touching of that patient? Could that amount potentially to a medical battery claim? I mean, there's some states who recognize that as a form of battery, unauthorized touching of an individual, and can award damages to that patient, without really there being any harm. And so those are concerns that I would have from a legal perspective. The problem with that is, again, which kind of makes this a little bit of a concerning topic, a little bit of a dark topic, an ick topic, is how would that patient ever know? Because that patient is under anesthesia and they're waking up not knowing that they had a prostate exam performed on them for practice. And is there, how many times was it done too? Because if you have multiple learners with that surgeon, is it going to be all of those learners who have to perform that examination? These are questions that I have just from, I guess, a patient perspective as well as a lawyer perspective. And so I'm glad to see that states have kind of caught on to this. And I think we need to, for our listeners, need to be cognizant of what your state says regarding these types of examinations. And now going back to, what brought us here in the first place is CMS. CMS's memo CMS has caught on to this, and that's why they published this memo. They've actually updated their interpretive guidance in their state operations manuals as it pertains to hospitals. And in particular, they have beefed up one of the examples under their informed consent guidelines as it pertains to what a properly executed informed consent looks like. So originally, they stated that practitioners, including residents who are going to perform important tasks related to surgery, they would need to get informed consent regarding that involvement. They have since revised that example to include not just residents, but advanced practice professionals and any other applicable students who would be performing examinations or invasive procedures for educational and training purposes. So those examinations that we're talking about, those sensitive examinations, and the examples that they give, these invasive procedures or examinations that are conducted for educational and training purposes include, but are not limited to, breast exams, pelvic exams, prostate exams, and rectal exams. So we have CMS here now stating you need to start building this into your informed consent process. Patients need to be aware that these examinations might occur during a particular procedure. So I guess maybe for my education, just give me a brief rundown of all right, so now we have this. What should informed consent look like?
So informed consent has always had to comply with first hospital policy, state law, and federal law. So while we have those 14 states that have at least briefly addressed this federal CMS update to the interpretive guidelines changes that. So now hospitals have to take this language and put it into their policies. And there's no clear-cut way how to do that. There's a lot of options that hospitals have to choose between how they're going to address this issue. So on top of those basic things that you've always needed for informed consent, which is where you're having the procedure, who's doing the procedure, the patient's signature, and then some informed consent policies give a little bit more. So,
what is the procedure that's being done? Is it my right leg or is it my left leg? What are the risks, benefits, alternatives? I want everything. I want to know exactly what is going to be done to me and what I can expect coming out of this procedure. Exactly. That's what I want as a patient.
Exactly. So not everybody has something so robust, but the really good informed consent policies do have something like that. But now, as a bare minimum, you're going to be required to make this note if students are going to be performing, students or other providers, if you're even as a physician, if you're going to be doing this as a teaching thing, are going to be doing this on you. So because part of informed consent is knowing exactly what's going to happen. So CMS has made the acknowledgement that this is something that requires informed consent. If it's going to happen, you have to do it.
Right.
You have to ask for the permission,
Yeah. And I know there's a lot of states out there, too, who have these laws that say that if you're going to perform these examinations, these sensitive examinations, we'll call them, they have to somehow be related to the procedure that you're also performing. So, you could, depending on what state you're in, there's many ways to skin a cat. So there's many ways that you can draft this consent form or the language in your consent form so that we're alerting patients to the idea or the potential of these examinations being performed on them. But the way this looks is really dependent on not only what your state law says, but also what your hospital policy and your culture, the hospital culture says as well. So you could, for instance, amend your surgical consent forms to state or to include language that these examinations may happen for diagnosis or treatment of a medical condition, that this examination would also be clinically indicated for the procedure that you're performing. So it's not like I'm going in for shoulder surgery and I'm having a pelvic exam performed on me. It wouldn't really be medically indicated. So I wouldn't say that would be an appropriate examination at that point. But you can also, I know that there was some other informed consent forms. Some actually have adopted separate forms for students, that there were going to be students involved in an individual's procedure, or there's going to be residents involved in that patient's procedure and having a separate informed consent form. I don't necessarily know if that's necessary, but again, it's all going to come down to the structure of your hospital, the culture of your hospital policy, and state law.
Absolutely. So the big gist of it is you have a lot of options with how you want to address this, how you're going to address this, but each hospital now has to take these new interpretive guidelines, sit down and decide how your hospital individually is going to address that, and work it into your policy so it's reflected in practice.
Fix the ick.
Fix the ick. That's it. So thanks for joining us today. And if you have any questions, please email Mary or myself and we'll help you out. Thanks.